Good morning, everyone. I'm apparently the real Andrew Jack from the Financial Times, written about global health for a number of years. I know malaria in different forms for some time, including both horrible experiences with chloroquine and Lariam over the years, so I feel the pain and the importance of digestible formulations as well as new treatments. So it's a pleasure to be here with many old friends and contacts for this important anniversary for you. So we've got 2 more sessions this morning before lunch. We're going to go a little bit later into a panel discussion. But first of all, we've got a couple of great presentations. 2 speakers who are going to talk about how ending malaria can contribute significantly to global health improvement. So delighted to welcome Minghui Ren and Pedro Alonso. So Dr. Ren will deliver a keynote on the importance of malaria eradication in the context of the SDGs. He's the Assistant Director General for Communicable Diseases at the WHO, and previously held a series of high-level positions in international agencies, including on the WHO Executive Board and with UNAIDS, and as representative of the Board of the Global Fund. And then Pedro Alonso, Director, of course, of the Global Malaria Program at the WHO, will speak. 30 years and more of public health experience and an expert in shaping evidence-based norms, standards, policies, and guidelines to malaria-affected countries. And he'll talk about progress and challenges in achieving the goals around the global technical strategy for malaria. So first, please, Dr. Ren.
Okay, good morning, everyone. It's such a great honor for me to be invited to join this 20th anniversary celebration and event for the MMV for malaria. And it's great partners for MMV to working with WHO towards the journal of malaria-free, which is not easy, but clearly we need more partners. Support is very important commitment. That's why I am so honored being invited to sit with my colleagues to make the presentation represent WHO. The collective vision of global malaria community is embedded in 3 very important key documents, as we hear many times, frequently, probably in your previous career, but has been presented on the slide. That's Target 3.3 of the Sustainable Goals of the United Nations, calls for ending malaria and other communicable diseases by the year 2030. And also WHO Global Technical Strategy for Malaria 2016 and 2030, endorsed by World Assembly in 2015, set very ambitious targets for the malaria by the year 2030 as well, including reductions in morbidity and mortality of at least 90% and also elimination of malaria in at least 30 countries. And also last and very recent document which is being endorsed by the World Assembly and member states is the WHO's 13th General Program's work calls for reducing the malaria deaths by 50% by the year 2023. Despite the absolutely exceptional hard ways made in the past 3 decades, reducing the overburdened malaria cases and deaths since 2000. But unfortunately, progress in recent years has since stalled. On the global scale, the progress remained inefficiency to reach the 2 critical milestones of global technical strategy for malaria, reducing malaria incidence and death rate by at least 40% by the year 2020. And the progress towards the malaria targets of Sustainable Development Goals and WHO's global programs of work is also, unfortunately, off the track. Recent trends in African countries hardest hit by malaria are of particular concerns. As seen on the slides, the number of cases in 10 highest burden malaria African countries has been on the rise since 2015. I don't want names of the country, probably you're familiar with, but this can give you a sense who are the countries supposed to be absolutely supported more intensively in the coming years. That's why we initiate the high burden to high impact approach, which is absolutely important flagship initiated by the WHO DG in 2018, provides response to the 10 high African countries plus India, which is enjoying 70% of global malaria burdens. This special initiative will ensure future success in global malaria control, supported and jointly with RBM to end malaria. This new approach is funded up to very important 4 key pillars: political awareness, better guidance and policy strategies, strategic information to drive impact, and also coordinated national malaria response. Through this approach, the countries are gathering critical data on malaria to better understand what's exactly geographical distribution of disease and what's exactly impact of intervention. And in line with WHO push for universal health coverage and primary health care, the high burden to high impact initiative will help ensure access to the right malaria control measures for those who need mostly. Although global progress has plateaued, but we still see some very good progress in few countries who are making the excellent strides towards the elimination of malaria. Since 2016, the WHO has been supporting the malaria elimination countries in their efforts to get to zero by the year 2020 through the special initiatives known as E2020. According to latest data, these 10 E2020 countries are on the track to reach the 2020 elimination milestone of WHO global strategy of technical strategy for malaria. These 10 countries absolutely should be fully recognized and be acknowledged and be supported. But all these countries were malaria endemic in the year 2015. Now they have either achieved the goal of zero malaria cases or are nearing the finishing line. Earlier this year, we hear from DG yesterday in a dinner, 2 countries received official WHO verifications of malaria certification, malaria-free from WHO DG and also respected RDs from PAHO and AFRO, which is Algeria and Argentina. The certification is granted when the country proves that the chain of indigenous malaria transmission has been interrupted for at least 3 consecutive years. In the global landscapes, WHO's leadership in providing technical support to the malaria endemic countries spans over more than 60 years. WHO supports member states by setting and disseminating our global guidance, policies on malaria control and elimination, supporting the countries as they adopted, and implement WHO global norm standard. They're helping the countries develop robust malaria surveillance systems and responding to requests from the countries and partners to address biological and operational emergency and bottlenecks units. As a part of the co-mandate, WHO also keeps independent score of global progress in the fighting against malaria. Our flagship annual publication, that is World Malaria Report, contains data which is absolutely latest available on the impact of malaria intervention around the world. We are working on the latest report in the coming months. Together with partners, WHO has also shaped the innovation agenda for malaria control and elimination to ensure that it's taken to scale. On behalf of WHO, I would like to recognize the critical role and the support by the MMV in the innovation space. In over this 20 years history, MMV has developed and delivered effective, affordable anti-malaria medicines that saves millions of people's lives of vulnerable population around the world. Thanks to our joint collaborations, children in Africa now have improved access to quality assured pre-reference treatment of severe malaria. And WHO and MMV has joined forces to support the development and evaluation and now registration for the phase of tefenoflucin and single-dose treatments that can dramatically improve the patient's compliance with anti-relapse therapies for PVAX malaria. Yes, we do. We have a lot of new vaccines. We have a lot of new innovations. But clearly, we need more. Even we launched our pilot programs of the first ever malaria vaccine projects, the RTTS in Ghana, Malaria, and Kenya. But we still have to do more innovations, including all the intervention, especially for the vector control and case management. So I would like to conclude my speech by quote what SDGs says in the WHO's seminar in September. And he said clearly, the goal of eradication malaria is supremely ambitious, but the true progress only happens when we set targets that we think are outrage. Together, we must rise to the challenge of stimulating new R&Ds. We must rise to the challenge of mobilized resources. We must rise to the challenge of achieving universal health coverage. If we do, we can deliver the world that we all dream of, the world malaria-free. So call the end, and thank you very much for your attention to my speech. Thank you.
Go ahead. So I've been asked to make a 5-minute set of comments, and of course this could be extremely brief. Yesterday the DG talked, now the ADG has talked, and all I have to say is I agree with all of them. Thank you very much for giving us this opportunity. Dr. Ren says, well, how about if you expand on a couple of these issues, and that's what I'll try to do. So he has alluded to our World Malaria Report, and there you have the 2017 and 2018. The first one saying that we were at a crossroad, the second one we need to get back on track, and the third one, which should be released on December the 4th, is still being worked on, because this is a huge effort that is not just done by WHO people. Perhaps people don't realize that World Malaria Report involves about 300 people giving input from across the world, from the CDC to PMI to Gates to IHME to different institutes and collaborating centers, and most importantly, the countries that actually sign off on those data. The last 2 years have noticed that, as has often been said, we have been plateauing in the progress that we had been achieving over the previous 10, 15 years, and the need to get back on track. Now, the other thing, I believe, which is really quite important, not that it's terribly new, but just the recognition that the world of malaria is actually rather heterogeneous. It's not one single picture, and increasingly being divided into two distinct buckets. On the one hand, and that's the top graph, the countries that are actually progressing towards elimination, and by now it's about 46 countries, about half of the malaria endemic countries, that have less than 10,000 cases, a figure that we can arbitrarily say you are within reach of elimination. So half of the malaria world is actually pretty close to elimination. Inversely, the other half still sustains very high levels of of transmission. And that's why we've identified the two initiatives that Dr. Ren has alluded to, the E2020, supporting the countries across the last mile, a mile that is often a long one. On average, countries with less than 1,000 cases still take more than 5 years to get down to zero. So never to underestimate how hard walking that last mile means. On the other hand, the high burden to high impact countries initially focused on the 11 countries, 10 in sub-Saharan Africa and India, that Dr. Ren has alluded to. But of course, being in that list, that infamous list, as the Minister of Uganda said a few weeks ago, is partly a function of transmission intensity, but also a function of population size of a given country. So a large proportion of endemic countries in sub-Saharan Africa still sustain unacceptably high levels of transmission. And when we say that we're plateauing, that we're stalling, we're still stalling, as Philip Wekhoff likes to say, at an unacceptably high level. In excess of 200 million cases and in excess of 400,000 deaths every year is not a good place where to stall. A couple of words on the elimination, which has been significantly alluded to. This is a source of good news. Challenges, hard to get through the last mile, but Algeria, Argentina, Paraguay have been certified malaria-free. We're looking with great optimism at a momentous occasion next year if China gets certified, together with one of the smallest endemic countries, El Salvador, and others. Iran, in the face of a complex environment, has reached zero and sustains zero indigenous transmission. And so there are many good news happening in different places. Now, before I hand over to Andrew Jack, a couple of other reflections on the global picture and the high burden, high impact space. Drug resistance remains a challenge. We all know that. And I want to also recognize the vision and leadership that Rob Newman, who's here in the audience, displayed following the initial identification of delayed parasite clearance in the Southeast Asia area in Cambodia, in setting up a specific program to help contain the problem and eventually eliminate it. 12 years later, malaria resistance, parasite resistance, delayed parasite clearance has not spilled out of the GMS. We do continue to have adequate antimalarial drugs to treat every case, and the disease incidence is dropping dramatically. And with the leadership of the countries and the ministerial declaration to accelerate the elimination of malaria, we are within sight of malaria, P-falciparum malaria, being eliminated in the GMS in the next 2, 3, perhaps 4 years. So a challenge, a source of concern, but one which the global community and with the leadership of the countries, it has shown that it can actually address. Secondly, I think we are in a much better space on case management than we've ever been before. We have a whole set of ACTs that remain fully efficacious throughout most of the malaria endemic world. We have different options, and so we are in a good space. Case management is an essential component of our malaria control efforts, particularly in terms of reducing severe disease and death. I'm not saying that no more work needs to be carried out in this space. Definitely more work needs to be carried out, but we're in a good space. The other area which we are increasingly paying attention, and I notice also Brian Greenwood is here in the room, one of the recent fathers of chemo prevention and the use of antimalarial drugs, not just for case management, but for chemo prevention. We see this as a key tool if we are going to be moving forward, particularly in the high-burden countries, as a highly efficacious approach to reducing severe disease and death. If I had to make a plea, and my friends of MMV know this very well, this is an area where perhaps we haven't paid sufficient attention over the last 10, 15 years. but one where more research and development effort needs to take place because it could actually yield great results in our global fight against malaria, and particularly bringing back the focus to what must remain our primary interest, which is reducing the unacceptable number of deaths that continue to take place. So with that, I reiterate my agreement with all that Dr. Tedros and Dr. Ren said yesterday, and happy to engage in a further conversation. Thank you very much.
So thank you both very much for those presentations. A reminder, on the one hand, of the vision and the momentum and some successes around moves to elimination in a number of countries, but also, of course, it's difficult getting the balance right between the optimism and the challenges ahead. And as Pedro was also reminding, of course, both in terms of resistance and continued support, and indeed some degree of stagnation in terms of progress in malaria incidents, a reminder that there's an awful lot more to do. But thank you both very much. Do please thank them again as they head off stage.